Hi, I'm going to be talking about Zofran, also called Ondansetron, which is an antiemetic. Now, for those 65 years and older, they are going through stages 7 and 8 of Erickson's stages of psychosocial development. Stage 7 is generativity versus stagnation. During this stage, the individual is very focused on what they're contributing, whether this be what they're contributing to their families, spending time with their grandchildren. They're very focused on others. On the opposite side, stagnation occurs when the individual isn't given positive feedback on what they're contributing. Stage 8 is integrity versus despair for those 65 years and older, and the person becomes very reflective on their life and what they've accomplished. This can be good or bad depending how the person looks at it, as this can cause feelings of depression. However, on the opposite side of that spectrum, it can also cause feelings of satisfaction and overall closure. Zofran's indications of use are to prevent nausea and vomiting. It's commonly used after surgeries or chemotherapy. Its mechanism of action is that it blocks the serotonin 5-HT3 receptor sites in the central nervous system, and also vagal nerve terminals. Some of the side effects are, the mild ones are headache, diarrhea, fatigue, dizziness, anxiety, agitation, and generalized weakness. Some of the more severe side effects of Zofran include bradycardia, which is low heart rate, seizures, AFib, angioedema, and myocardial ischemia. So, some of the nursing considerations to keep in mind when caring for an individual 65 years and older as well, who is taking Zofran, are to consider the patient's liver status, because Zofran is metabolized in the hepatic system. So if someone's diagnosed with liver disease, you're not necessarily going to want to be giving them Zofran because their body's not going to be able to expel it properly. Number 2, a patient should not receive more than 8 milligrams a day of Zofran, whether it be by mouth, orally, or through an IV. And 3, Zofran can be administered without regards to meals, meaning you don't have to have food with it. And 3 things that the patient should be monitored for, or just to be aware of after taking Zofran, includes monitoring for prolonged QT intervals, because Zofran has been known to cause this in the geriatric population especially. So that would be something that the nurse would need to keep an eye on. Perhaps put the patient on a telemetry monitor. 2, Zofran can cause motor function symptoms such as extrapyramidal reactions like tardive dyskinesia, restlessness, muscle spasms, or even tremors. So that's just something to look out for. And lastly, you would want to monitor for decreased nausea, because that's how you're going to know that the Zofran is working, that's being therapeutic. And you can also know that the medication is working if the patient is having an increase in appetite as well. So, thank you for listening.